very nice gentleman here, Mr. Paul Farrell.
Correct, yes.
All right.
That is correct.
Paul had come to us back probably early May.
Correct.
All right. Paul is an avid marathon runner. I guess he also runs 5Ks and does other things. And
Correct.
you can see he's in very good shape. And Paul had seen other physicians in the area due to some severe degenerative disease in his right hip. Paul had the visco supplementation injections. Had you had anything else at that point?
I had a cortisone shot to begin with, and then the Orthovisc.
So you had a trial of how many injections of Orthovisc? Three.
Concurrently, 3 weeks, 1 week apart.
Okay, and
yes.
then did you see any improvement after that?
I saw an improvement for approximately 1 week.
Okay.
Hence, it didn't last. The same with the cortisone shot. I was good for about a week.
Okay. Were you on any other oral medications at that time? Probably oral anti-inflammatories.
Anti-inflammatories.
And you had also tried physical therapy, correct?
I tried physical therapy, but essentially the pain was still there.
Were you able to run?
No.
No. Had you ever been able to get back to your running level?
Not to where I was. There was no trust in the hip.
Okay.
Sleeping at night, there was somewhat getting to the point of discomfort at night sleeping.
Okay.
And consequently, people at work were telling me that you seem to have a bit of a limp.
Limp. Okay.
And I consequently made a joke and said I work in a factory. I said I just hit my leg on a skid, which was a big lie.
Okay.
I was consciously trying not to limp, but I knew I was.
So from that point, I guess you were kind of desperate and you were seeking treatment.
Correct.
From some alternative measures, I guess.
That is correct.
And you had some knowledge about stem cell injections.
I had knowledge. I went on the internet. Because I'm an athlete, an avid marathoner, and in general, I did do a lot of research on this, and I work in Clifton, and I decided to call Dr. Russonella's office based on his record, his knowledge, and as a result, I'm very happy because
yeah. So why don't we just tell them? So we offered a bone marrow aspirin injection, taking it from the iliac crest.
Correct.
And we went over that with you, and we
Yes.
explained how it would be done, and that we would do it under a fluoroscopic device, as well as putting the hip under some slight traction.
Correct.
All right, and you understood that, and you felt okay doing that, correct?
Yes, it was explained to me in full by the doctor and his staff. I was under general
Yes.
anesthesia.
We did that to relax him, okay?
Yeah.
Because he has a very tight joint, and to get inside that femoral acetabular joint, I felt that if we set it up like a hip arthroscopy for only 10 minutes that we were there, 15 minutes, that it wouldn't have any side effects, so that we did it that way. And we took the bone marrow without any complications. We spun it down, and I think we had 5 cc's, and again under direct fluoro we injected his hip, and now it's been
5 weeks.
Five weeks. So why don't you say, how do you feel today?
I'm lost for words. I feel like I can.
Go ahead.
I feel like I can run another marathon.
Yeah, we're gonna go slow with that.
I just want them to cut me loose, but that's not going to happen. I'm a very smart runner.
But you're sleeping at night is better?
Sleeping at night much better. Life in general, range of motion. I just finished my last PT with Kevin, and he had some readings prior when I initially went in. My range of motion was limited.
Excellent.
This is my last session now, and my range of motion is equal both sides.
Excellent. So if you had to do this again, what would be your recommendation? Would you do it again? Say, just God forbid, the left hip had the same problem. Would you consider it?
I would definitely consider it with Dr. Russonella and his staff. I have every confidence in him, and thank you very much.
Thank you very much. Good
Great.
luck. All right.
Great.
All right.
We're off camera.
We got to bring